Hello everyone. Today's video is another Q&A video on MSM, also known as methylsulfonylmethane. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the questions just keep on coming in about MSM, so I'm going to keep on answering them. So the first one says, I am one of those hypersensitive people to detox. I would love to hear you share any anecdotes/cases of patients who are very sensitive to detox, and maybe just share some details, like you have seen people where it takes 4 months to get up to a higher dose. Are there other things that can be done to reduce detox symptoms besides backing off? Because MSM helps with detox, have you seen any patients who initially were very sensitive to the detox, but over time their body did enough clearing that they became less sensitive to detox? So lots of good questions wrapped up in there. So yes, I have a number of patients who have taken several months to build up to the full dose of MSM. I've had some patients where they've only been able to get up to, say, maybe 5 or 6 grams of MSM, where our target dose for those particular cases was more like, 20, 25, 30 grams. So there are definitely patients I've worked with who just get up to a lower dose, and that's working well for them, so we don't need to go further. There's other patients where it takes quite a long time to build up. I've had patients where they started with 1 gram and they flared from that, so then we drop it down to like 250 milligrams, then 500. We build it very, very slowly. And then with some of those cases, it's just a slow grind, 1 gram at a time. And then in other cases, it's a very slow grind, say up to 5 grams, and then they're able to start picking up momentum as they're starting to feel better and they're tolerating it better. I've only had 1 or 2 patients that I can think of where it was my idea to throw in the towel on the MSM. I've had a few other patients who have opted to throw in the towel, and that wasn't my advice, but it's their choice, and I'm going to support them in what they choose to do if they're making an informed decision. But with some of the patients where they come in, they're like, yeah, they flare from lots of things. They're sensitive to a lot of things. Like, yeah, MSM was just another thing I flared from. And in those cases, I'll say, like, this is really worth pursuing in your case. Can you please, drop the dose? We'll try it again. And I'd say 90% of the time, then when patients have persevered, gone slowly enough, then they've been able to get up to a higher dose, and in many of those cases they feel better for it. So it's a very worthwhile thing to work with, because as I've said in other videos about MSM, MSM is a fantastic source of sulfur, and sulfur is a fundamental building block of our bodies. To my understanding, it should be the 4th most common mineral in the human body. So it's really, really, really important. And so it's not like, oh, I couldn't tolerate that particular herb to treat SIBO, we'll just go find something else to use. Or I couldn't take that particular binder to help get rid of my mold toxin, or that particular antibiotic to kill the Lyme, like we'll just use something else. There's nothing that replaces sulfur. And while there are other supplements and compounds that do contain sulfur, none of them are nearly as sulfur-rich as MSM. And they tend to be, in my experience, really, MSM tends to be one of the best tolerated things. So I do go to bat for MSM with a lot of my patients, and it can be a bit of a slow grind. Just kind of riffing on some of the other questions in here. In terms of other things that can be done to reduce detox symptoms besides backing off MSM, nothing that works nearly as consistently well as just backing off on it, just giving the body more time. Like now, I don't bring MSM in just willy-nilly. I bring it in at a time where I think the patient's likely going to be able to handle it. So if I haven't already started supporting their methylation cycle pathways if needed, if they're constipated, if they have other symptoms like a lot of lymph node swelling or lots of rashes and acne outbreaks and different things that make me think, oh, your detox pathways are really gummed up and blocked right now, I'm going to do all that work with my patients first before I bring in MSM. So I'm not just using it in a cavalier kind of like nonchalant way. However, if a patient is, despite all my best effort, they start the MSM and they start to flare, they start to detox excessively, we just back off in the MSM and build it up gradually. There's not really a magical co-treatment to work with that's going to help them tolerate the MSM better, unfortunately, at least not in my experience. If anybody knows of a good option or what's worked for you, please let me know in the comment section. But there's not a one-size-fits-all that helps with MSM detox being smoother in my experience to date. And let's see here. And then just the question about can patients over time, if their body does enough clearing, that they become less sensitive to detoxification? Absolutely. I have patients who are incredibly sensitive to things, and over time they become, like I affectionately call them, normies. They're no longer a super sensitive patient. They're no longer those universal reactors. They're now just a normie. And yes, they can still flare from stuff, but they don't flare like from baby doses of this, that, and the other thing. So yes, folks do become less reactive to things when their physiological resilience improves. I also have some patients, I've talked about this in other videos, where their reactions to things don't really abate until their nervous systems become more resilient. So in some cases, it is very much just strictly physiologically based. In other cases, there is a nervous system component, which is physiological too, but I guess I mean gummed up, blocked up detox pathways, etc., is sometimes what's going on. Sometimes it's more of a nervous system reaction to things. We need to do amygdala retraining and other types of nervous system rebalancing, if you will. So anyways, thank you for the multitude of questions that were built into that one question post. Those are good. That was fun to answer. The next one here says, so I've been slowly raising MSM dose, got to 22 grams, and got anxiety and a slight higher blood glucose level. How long do side effects take to go away? I started it 1 month ago. I do have a history of anxiety disorder. So in my experience, an MSM-induced flare is usually going to go away pretty quickly, usually within 1 to 3 days at most. There might be some rare exceptions there. I definitely wouldn't expect symptoms to persist for a month. I don't think I've seen MSM cause anxiety in anyone so far. I can see how that could theoretically happen, just because MSM does seem to have some methylating ability, because it is methylsulfonylmethane. In my interview with Dr. Kathleen Janelle, I believe I asked her this question, and she said, no, there's no evidence to suggest that there's an ability of MSM to methylate just based on the way it's processed biochemically. But then she did email me, I don't know, within a few weeks of that interview and said, hey, I've actually found a research article that suggests that maybe we do actually methylate from MSM. So it does seem like that's plausible, and that can sometimes cause anxiety issues. I've never seen MSM cause a blood sugar bump, and where it's mentioned as a slight blood sugar bump, it's like, I don't know, it could be, I guess it depends on how slight, but it could have been maybe related to something else, I'm not sure, but I'm not aware of any mechanism by which MSM would cause a blood sugar spike, certainly not a persisting blood sugar spike. So haven't seen those in practice, but those are my thoughts. So hopefully that's helpful. What dose of MSM is recommended for a woman in her mid-60s with hair falling out and loss of skin elasticity? So of course, my answer to this is you should talk to your healthcare provider to get advice on that, because I can't give advice over social media. However, I will just mention that I have seen a lot of benefit to hair not falling out anymore. Now, if it's like male pattern baldness, that's a different kettle of fish. But hair falling out when it's not related to male pattern baldness, I have seen MSM work really, really well as in helping with improving hair fullness and thickness and integrity. But generally speaking, for a patient that I was working with that was having issues with hair falling out and issues with skin elasticity, because sulfur is really important for connective tissue, collagen integrity, I would be thinking of going like fairly high dose, kind of looking at more of a max dose. Some patients see benefits down at 1 or 2 grams for joint pain and things like that. But in my experience, we usually need to go higher. And again, not giving any dosing advice, but usually like above 10 grams, sometimes as much as 30 grams is what I'm using with my patients on the regular. But we're being really cautious and mindful with how fast we build that up, because we can see a lot of detox issues if we go too quickly. So really a good idea to work with a healthcare provider when using MSM, especially at higher dosages. How does crystal versus powder MSM differ? I'm not aware of any clinical differences between the two, so that's a pretty quick one. And then there is a longer one here about, let's see if I can just paraphrase it. So basically the gist of it is the person was dealing with hydrogen sulfide SIBO by the looks of it. They were feeling a lot better on MSM, then they stopped it, and then it seemed like they needed a higher dose of MSM to get the same benefits. Then they found that certain prokinetics they used, so it sounds like maybe a pharmaceutical, so maybe something like precalipride / Resitran, and magnesium used to help, but then now that's exacerbating their symptoms. And then so it says, as someone who doesn't know, it feels like the gut bacteria are firstly trying to adapt to new conditions, and secondly trying to get food from places they haven't gotten it before, because they sense a threat to their survival. So I'm a big fan of thinking about things through the eyes of the microbes. So yeah, I'm looking at stepping in their shoes. I think that can be really helpful a lot of the time to figure out what's happening physiologically or pathophysiologically. What I can say is that I've definitely had patients who need a higher dose of MSM over time, and whether that's because of a shifting microbiome or not, I don't know. I think there is some loose evidence that suggests that MSM might have a bit of a biofilm disrupting action to it. I don't know if that's been substantiated, but there might be an element of that going on. And then also if the body is just getting better at absorbing things, then maybe the body is, at first it was a lower dose is helping the gut because there wasn't the best absorption or was getting used up in the gut, but now the gut lining is healed up. Now there's sulfur getting sent all throughout the body, and now there's a higher dose that's needed to maintain those, to perpetuate those good effects in the gut. So that would be my kind of prevailing theory with something that might be with that type of scenario. Shoot, I think there was another question in there, but maybe I lost it. Right, and then in terms of why supplements that had been helping are now causing an exacerbation, I guess it depends on what symptoms are getting exacerbated specifically, but as our gut motility improves, our gut microbiome improves, the same dosages of, say, magnesium or prokinetics could cause looser stool or gut irritation in some folks because those agents could potentially speed up the rate of food transit through the gut. I have some patients where they find that oftentimes just magnesium or prokinetics just give them benefits with no side effects, but some folks find that if they take too high of a dose, not only does it cause loose stool, but they also get more gas and bloating, presumably because there's just more water getting flushed into the intestines. And that might be causing things to move through too quickly. So that might be why. In other words, a person who's, say, has a perfectly healthy gut, you give them enough magnesium, they're going to maybe have some gut upset. You give them prokinetic like prucalopride, that might cause some gut upset because it's kind of disrupting the normal flow of things. In other words, as MSM is healing things up, improving the gut motility intrinsically, those other agents might be now no longer a good fit because the patient doesn't need as high of a dose of those things anymore. Next one is, I got a skin hive after 1 teaspoon of MSM and water. Any ideas? My thought would be, if I saw that in one of my patients, I'd be thinking probably detoxing too quickly, causing the mast cells to get a bit ticked off and then seeing a hive. It says, can you please address the issue with insomnia after taking MSM, even with a low dose? Why is taking MSM causing insomnia? Will it go away after some time? Yeah, so this is something I talked about in another video. Some folks find that if they take MSM too close to bedtime, it can cause insomnia. So with my patients, I just ask them to take it earlier in the day, and that seems to rectify it. I really haven't seen that many cases of it happening, but in the few cases I have seen, and I think there were a couple of comments on some of the other YouTube videos just saying that folks had observed this and they just took it earlier in the day, and that seemed to clear it up. Says, I'm taking 4 grams of vitamin C every day and want to take MSM. How can I take MSM and vitamin C together, or for example 4 hours later? Are there any side effects with taking them together? So I find personally, I take MSM every day myself, twice a day. I just take it with my other supplements. Vitamin C is in one of those supplements. It's one of the ingredients in the mitochondrial support formula that I've talked about in many other videos. And so I combine the two together. MSM seems to play nicely with a lot of things. So I take it with my magnesium, my mitochondrial support, my digestive enzymes when I take those, and I combine them with lots of other things, vitamin D, etc. It seems to play really nicely with a lot of other things. And then the very last question is, I am a coronary artery bypass graft patient, and can I take MSM? So again, I'm not giving any treatment advice over social media, but I'm not aware of any contraindications with MSM and folks who have coronary artery bypass grafts. So absolutely talk to your cardiologist before working with something like that, but I'm not aware of any contraindications with those. So if you wouldn't mind please taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thank you in advance for taking a second to do that. And if you have any questions on MSM or on anything else, just post in the comment section below, and I will do my best to answer as soon as I can.